Welcome back to the morning show here on Rise News. I'm Rafai Hosseini.
I'm Adeso Omoron.
And I'm Shaito Atigari. Good morning.
Now, Nigerian startup market is on the move, often described as a leading hub for entrepreneurship in the country due to many factors, including a growing population with access to technology.
Having experienced a boom in the past few years, the Nigerian economy is witnessing new startups, which are springing up on a daily basis with the aim of providing solutions to perceived problems.
With the just concluded Africa Investment Forum in South Africa, growing more startups has become imperative for global interests. So joining us now is Dr. Ikpeme Neto, the founder and CEO of WellaHealth Technologies, who is currently pioneering the adoption of affordable health microinsurance across Nigeria using innovative channels and methods. I mean, it's a joy talking to you on the heels of the African Investment Forum in South Africa and the fact that health coverage is still a big problem in Nigeria. I mean, the stats are very staggering. A couple of years back, Olusegun Obasanjo started what was supposed to be modeled after the NHS, the National Health Insurance Scheme. But to a large extent, we've not done a lot as regards that. The inclusion rate is still less than 2%. So the solution will probably be micro health insurance. I mean, how does the mechanism work?
Oh, great. Thanks for having me. And so it's simple, really. With microinsurance, you're targeting people with sort of middle to lower incomes, right? And these people cannot afford a lot, you know, your 5,000 naira a month plan, 60,000 naira a year. And so we've broken it down. So it's just, you know, a couple of hundreds of naira, 400 naira. But the thing is, we only cover a small subset of things. So, for example, we're starting with a malaria insurance. That means that people, for just a small amount, get access to very high-quality malaria care.
Well, how is this different from already pre-existing insurance scheme? I know it's perhaps the money is cheaper, but is it micro because of the money or the number of people you can reach or the places you're reaching? Why is it micro?
Yeah, so really micro is defined by the kind of people that you're targeting, you know, and so at the price we're looking at, sort of 400 naira, really a large proportion of people can't afford it. And so really that's what defines micro. Because once you define the price, then that helps you to decide the kind of services you can provide. The innovative thing we're doing as well is making it more accessible using sort of community channels, community pharmacies, local clinics, so that people can get in quicker, they don't have to wait.
You know, every chance that you get to empower startups for me is a good cause because they do struggle, and most start up with a struggle. But how do you make it sustainable, you know, in an environment like Nigeria? Because we do have those ones that fall along the cracks that, I mean, microinsurance, the money is a bit less. So how do you make it sustainable in this ecosystem?
Absolutely, I agree with you. It's difficult running startups. The stats say something like 90% of startups will fail.
Yeah.
And so there's a lot that can be done around making life easier for startups. I mean, recently we heard about Nigeria doing a little bit better in the ease of doing business scale. Certainly those sort of parameters and figures are places that the government can look at, you know, making it easier for people to get access to permits, reducing the amount of taxes you have to pay, giving you tax breaks and holidays when you start off. Very important areas. And certainly investment. So investment is super important. That people are able to easily access, you know, investments to be able to grow their startups and businesses.
Speaking of that, I think the government, I mean, and I want you to react to this. I think the government has got something like a financial plan next year for businesses. And the threshold was quite exciting when I saw it yesterday. The fact that if your business makes 0 to 25 million, you pay 0% income tax, company tax, corporate income tax. If your business is from 25 to about 100 million, you pay less than the normal 34% corporate tax and things like that. I mean, this incentivization, what has it done? What does it mean like to you as a startup?
I think it's great, and I want to see that come in. The challenge sometimes I find is that the policies are enacted, but they don't trickle down to the sort of the person on the street that's enforcing it. And so you open up your business and 10 people come and start sort of harassing you. You as the entrepreneur then has to go find what the laws or the policies are and come back and do it. I mean, we don't have the time, we don't have the resources to do that. So yes, you know, it'd be great to see, but we want the government to have those policies trickle down to the guy on the street that's going to come in and enforce them so that everybody is working to make business easier and better for people.
I like the fact that you're starting up with malaria. It is fantastic that you're doing that. Malaria is a serious public health challenge in Nigeria. It accounts for over 60% of outpatient visits to hospitals. And let's not even talk about deaths. 30% children mortality, 25% children under 1, but about 11% maternal death. And it goes on and on. But let's talk about quality of health, because even with the existing HMOs and health insurance that you have, one challenge you hear Nigerians complain about is the quality of healthcare they get from those HMOs and those hospitals. They're not different from any of the hospitals or doctors or facilities you are engaging. How do you ensure that even though I'm not paying this thousands of dollars or naira for health insurance, this little money I'm paying for, I can get quality? How are you ensuring that?
Absolutely, great question. And I think this is where startups are great. They provide a lot of innovation that can happen. And because that's what we've done, is we've actually come in to say that beyond just being an enabler of microinsurance, we actually are involved in the quality of healthcare, right? And so with the healthcare providers we work with, we're intimately involved in making sure we have the logistics right. We train them. We have technology that monitors them. We follow up with our customers, have a lot of surveys. So really, we have a process around monitoring that quality. And when we find people fall below that quality, we kick them off our system. But because we're providing revenue to businesses that we work with, because they're healthcare businesses, because we're providing revenue to them, it means we can really crack a whip, if you like, to make sure that you're providing a certain amount of quality that we want them to.
Still on this issue of healthcare, I mean, it's a good thing that this is where your focus is going towards. However, a big part of startups is the tech angle to it, and we still find that we have about 70% of tech-based solutions still being run by expatriates, if you so will. How do we bridge that gap? Because we do have a lot of young, smart men and women that can develop solutions in the tech space. How do we bridge that gap?
I think there's a lot that the government can do, right? And so even within the government, with how they pick the solutions that they use, right? For example, if you look at the US, they have a mandate as government procurement. They give about 30%, I think, of their procurement to small businesses. We can do something similar with technologies that, whether it's 30% or 50% of the technology that's used in public places, in government offices, should be sort of local technology, because that really helps to spread the local ecosystem. Because that money, instead of going to the big companies, big multinationals abroad who already have a lot of money, it can come into our own local ecosystem, start to develop companies, start to develop more people, and then we can start to grow a lot faster.
I mean, that's very well said, because, I mean, when you take, I was studying a report recently that says even in some government parastatal, things like accounting software are still being given to companies from countries like Georgia.
Absolutely.
And only to think that Nigeria, say, has one of the most robust accounting software for banks. Started developing accounting software in the 1990s in this country.
Being used by people, banks outside the country.
Being used by banks outside the country. So when you look at all of that, I just want to also juxtapose that with how many hospitals do you have on your list now? And secondly, quality control is another very big thing. Is it only malaria it covers? What are you doing as regards, warding off the other big HMOs? Because this is the lower end of the market. And let me also add this by saying, in recent times, we've seen a proliferation of all the top tech companies coming to Nigeria. I mean, Nigeria is the next big thing.
Absolutely.
Jack Ma is in town as at yesterday. Maybe he's gone today. I was with Jack Dorsey last week at TechPoint's office, and he was talking about coming. In fact, he even further said that in the course of next year, he will be staying in an African country for 6 months. Be living in here, get a house in Africa, leave. That's the CEO of Twitter, just to study the ecosystem. There and then, he signed up the guy that developed the Twitter bots. With these people coming in, what's the hope for our local market?
So I wouldn't say what's the hope. I would say there is hope. I mean, clearly they see something here, right? And I mean, Africa, Nigeria leading the way. It's a very young continent, right? Over 1 billion, going to grow a lot faster. The rest of the world is aging. And really people that know and are looking to the future know that the future is in Africa. And so I think it's really encouraging that we have that happening. I think more so the challenge is that we perhaps don't see the opportunities ourselves, that sometimes it takes the foreigners to come in and sort of open our eyes to those opportunities. And so it's great that that's happening, and I think we need to open our eyes to the opportunities. With regards to the previous question you asked around us, I guess you said warding off other HMOs in the area, I think, again, there's a large opportunity here. We're, 170, 190 million people, and most of us don't have access, right? So there's a huge market for a lot of people to play in, especially when you're doing something innovative like we are and targeting people that have never had access in the past to something like this.
Number of hospitals?
Well, number of hospitals. So we actually work with community pharmacies more so, and we have a remote telemedicine service. You asked about what other services do we do. So we have doctors that are remote that you can use your mobile phone to chat with, have a call with to make sure that you're getting the right care. We work with community pharmacies, and we're over 400 community pharmacies across the country. And we're growing that number to about 1,000 early next year.
What has the reception been like? Because there's the issue of trust. Absolutely. I mean, going to see a doctor, some people will say technology is coming to displace doctors. I mean, the ability to interact with your doctor to say, doctor, you know, you need to check me, you need to see me. What's the reception like?
So yes and no. You say displace doctors. Well, where are the doctors that we're displacing is the first question. You know, I'm a physician myself. I'm a doctor. I trained abroad and came back to Nigeria. A lot of my colleagues are leaving or have left, right? And I'm not returning. I'm in the minority.
The Minister of Labour said we have more than doctors in the country.
I don't want to comment on that because, to be honest, I was very inflamed listening to that because we don't. The honest truth is that we don't. A lot of us are leaving and continue to leave. Every time there's exams for going to the UK or the US, there's hundreds and hundreds, all Canada, absolutely, hundreds of doctors doing that.
Right now, the plabs like crazy.
Absolutely. So we don't have the doctors. So we're not displacing doctors. If anything, we're trying to make doctors more efficient, right? So that you don't need a doctor to treat malaria. You don't need a doctor to diagnose malaria, right? You need a doctor to treat your diabetes, your cancers, your heart disease. Those far more, difficult things to treat. But malaria is simple. It's a simple pinprick test at a pharmacy. You get a result. You get your drugs, you go home, and then a doctor can remotely follow you up if you don't get better.
Yeah, as simple as it is, it kills millions every year. And you mentioned that you studied abroad and you also practice internal medicine. And I want to ask you a general question now on the health sector. What is your opinion of the Nigerian health sector? What is wrong with the Nigerian health sector?
How long do you have? What I will say is that there are a lot of opportunities, right? And again, speaking about startups, there's other startups like myself that are working in the space to make things better. It isn't great, but there are a lot of opportunities. And so, having the government put in place strategies around policies that help private sector to come in to actually fill the gap. I know we spoke about the African Investment Forum, so allowing it easier for investors to put money in. I mean, I have some local investors, for instance, in my company here in Nigeria. It'd be great to see them have tax breaks, more incentives, right, so that people can put in money to this because, yes, they want to get money back, but it's a social good here as well, right? And if they feel like they can get something back from the government by way of a tax break or a tax holiday, individually, or if you're a high net worth person, more encompassing. But that gives a lot of opportunities for us to put more money in here and actually start to solve the problems more innovatively.
Okay, so, you've spoken about, we do know the first objective of a startup is to solve a problem, and I'm curious to know how you identify, support, and domesticate solutions because history shows that, the governments are not necessarily good managers. So are there other stakeholders or networks that you kind of link up to identify, support, and domesticate these solutions? And apart from, what we've been speaking about in the healthcare sector, what other startups are you looking? You said that you have a few startups yourself. What other startups are in place right now to make sure that we have solutions to the millions of problems that we have as Nigerians?
Yeah, there's many of them. But I think generally looking at other stakeholders, and again, the government, I keep talking about the government, but I think government is central. You look at universities are a central part of actually building out startups. And so if you look at the biggest startup ecosystem in the world, is Silicon Valley. At the heart of Silicon Valley is Stanford University. And so what people don't realize is that the government actually puts a lot of funding into research in universities. The advantage of those that kind of funding is that you don't have to pay it back. And so you can have somebody that's very intelligent, that sits in the room and just thinks about how to go about things in a different and innovative way. So we need a lot of universities, research institutes with funding that can start to think about things. And so when they develop new technology, they can then give it to people like myself, the crazy entrepreneurs that will go out and find a market for it. It's difficult for us as entrepreneurs to go and do the original research.
Dr. Neto, sorry to interrupt you there, but we'll have to go on a quick break and we're back to talk some more. Join us again.
All right, still the morning show here on Arise News, and we've got Dr. Ikpeme Neto, the founder and CEO of WellaHealth Technologies. And just to continue from where Shaita was asking, she was talking about other startups. We'll talk about that. But for me, the big question I ask is that of collaboration. And I'll give you a case scenario. So this is the case scenario. I was a little bit iffy when you talked about local pharmaceuticals. You know why? Because they can get their drugs from somewhere in nature that's probably peddled with chalk. But you know, a startup that a very good friend of mine invested in, Tommy Davis, called Spiroxyl.
Yes, that's right.
Pretty much does something to solve that problem. You know, so you have a scratch card on the drug and you just scratch it and you send a message in them. So is there any collaboration between you and Spiroxyl? Is there any way of taking those local, you know, people through Spiroxyl test? And secondly, I was thinking that is there any platform at which you can say, okay, you know what, my 400 pharmaceutical, my 400 chemists, like they call them in local parlance, I'll take you to Emzo. I'll strike a deal with you. So I know that the quality of your Panadol is from here.
Yeah. Absolutely.
So is there any way you're doing that?
So yes, so we are. And so I'm glad you talk about Spiroxyl. It's interesting aside is that Spiroxyl came out of work that was done in research in a university, right? Back to the point about, research and universities being important. But yeah, so Spiroxyl, I think, has been really transformational, them and a couple of other companies in that space. And so with the pharmacies we work with, we allow them only dispense drugs that have Spiroxyl's mobile authentication system on them. And so that you as a patient, when you get it, you can scratch that off, get home, text, and then it gives you a response back. Now, it's not 100% foolproof, so there is still, challenges there, but solves a lot of the problems. The other thing we're doing is actually working with pharmacies that are licensed and properly trained, right? And so we don't just work into anybody, at least not at the moment. We work with people that have a license, are regulated by the Pharmaceutical Society of, the Pharmaceutical Council of Nigeria, those kind of things. When you go deeper into sort of rural areas, then you talk about the chemists in particular, and those prove a very different challenge altogether. We're not there yet, but we have strategies around how we're going to make that happen, and working with Spiroxyl closely, which we're starting to do, is certainly one of them.
Oh, well, I know you own the WellaHealth Technologies initiative, and you also help other startups. What are the challenges you've seen so far? Some people would say, for a lot of startups, it's funding, venture capitals. They're not really available. You can't turn to the banks. Where are you turning to for funding? Yeah,
so I agree. So funding is a big one. And yes, the banks will not fund this. And fair enough. I mean, the rest of the world, banks don't necessarily fund this kind of innovation, right? So because startups are searching for markets, right? And so banks really like established businesses. You have cash flow. They can predict, if I give you 1 million naira, you can return this and that. So equity-based funding is certainly what we need. And so venture capital is traditionally where you go to get that kind of equity-based investment to fund sort of high-risk businesses, right? And so venture capital. The challenge, of course, is we don't have as much venture capital in this part of the world, right? And so, like myself, going out to look for funds, there's only a handful of people you can really speak to, and they themselves, don't have that much capital because they have to sort of go out and find that capital. And so it's really, you're scrambling, you're working hard to get that capital in. But beyond that, so financing is certainly one. Beyond that, so even after you have financing, or even before, getting access to the right talent is really difficult. So look at our educational institutions. Unfortunately, they're not sort of churning out the right kind of graduates that you want. You can sort of put into a job straight away and be happy. You have to do a lot of micromanaging. It can be very difficult with talent, right? And then the market itself, because of the generally low, education and understanding around technology, what you have to do a lot of times is educate the market. And so you find that beyond just, okay, I have an app on my phone, or I develop an app, and then I ask somebody to install it, and they don't even know how to, what is this 3 little lines on the side, what is this? So even that whole process takes a lot of time and effort to do. So those are the kind of challenges that we face.
Okay, so I want to bring you back to, because you had mentioned Silicon Valley, and it's a system that has worked, for the United States. However, there are people that are of the opinion that the Silicon Valley model would not work in the Nigerian tech startup space. I'm curious to know what your opinion about that is, and it's largely the reason has been largely dependent on our socio-economic background in Nigeria, that being like the major thing. I'm curious to know what your take on that is.
I think generally the jury is still out. I think we're still early days as far as sort of startups and venture capital go. Silicon Valley is certainly one model. And I think it's hard to say now for sure that it's working or it isn't. I think we're just still learning. But I think certainly there are a lot of tweaks we can do around how Silicon Valley does things. And people have said to look sort of more east towards China, India, and see how things have developed there. But I think we would have to develop our own unique ways, right? Because our markets are different, the demographics are different, the culture is different. So I think at the end of the day, we're going to come up with some hybrid Nigerian model that will ultimately be successful. And we can only find that out after the fact, when we have 5, 10, 20 companies that have been very successful, and they go out and sort of publicize how they did it. And then we can start to have learnings that we can translate back and say, well, if you want to be successful in Nigeria, these are the things you do. Because that's how Silicon Valley got there. It's after the fact they sort of came back.
But we have a model that works that you can just plug and play. It's called the Alabacon model.
Right.
Yeah. I mean, an American professor presented a TED talk recently that talked about the fact that Alaba is the most viable business incubator in the world. The apprenticeship system, the age-old apprenticeship system among the Igbos.
Absolutely.
So why can't we just plug and play that system into business? Because you tend to have a better disposition for capital once you get money from that model, because you know your orga is settling you. You know there are no venture capital, so you're condemned to be successful. What do you say about that?
Yeah, I agree. And again, like I say, we're going to find out after the fact what has been successful and what will be successful. The challenge with maybe not challenge, but the thing I see with the Alaba model is that I don't know that they've really grown technology startups, right? And so it's more traditional business. And so certainly, yes, traditional business is certainly the way to go. But is that the way to go for technology? And I say technology because with technology, you can reach billions of people, right? So is that the model to use for growing technology startups? I don't know if it is.
But they invested in a lot of technology startups. There are many startups today that the key investors that are doing quite well that I know of are the boys from Alaba.
Oh, absolutely. And so for capital, yes, potentially those Alaba boys, if you like, can bring their capital into technology. And so, I mean, I don't dispute that. I think it's yet to be seen. And I would certainly encourage that people try things out. I think sometimes we're a bit reticent to be experimental. I think it's very important that we're experimental and that we publish the things that we learn. A lot of us are a bit too secretive. It's important that we actually say, this is what I'm doing, this is what I learned.
Great that you said that, because I was going to ask you, since you help other startups, what are the mistakes you've seen? Because everybody wants to own a business this day. It's seen as a breakthrough for the economy. But what are, like, if you could give me the top 3 mistakes you've seen with startups in Nigeria, and then I'd like to bring it back to health. Your micro insurance health initiative, is it just in Lagos? Where do you have it? How can people access it? And do you think of incorporating other health challenges, apart from malaria, for instance, the almighty cancer?
Okay. So top 3 mistakes I see people make. First is not understanding the market. And so you find, I mean, e-commerce is one tale, right, around people putting a lot of money into e-commerce.
They get burnt.
And they got burnt, exactly. Sorry about that, but I think we didn't really understand what the market needed. Even beyond what the market needed, what the market wants. So the fact that you have a product that solves a problem doesn't mean that the market actually wants that product.
Very true.
And so I think understanding first what the market wants.
Okay.
The second thing would be patient.
Be patient.
And so one of the biggest success stories as far as business in Nigeria over the last few years has been this noodle company.
Okay.
But if you read when they started, like Nigerians weren't eating noodles at all. Apparently when they started, people were like, what's this snake thing? I'm not going to eat this at all.
It looks like worms.
Exactly, worms, sorry. Yeah, this looks like worms. But today, everybody eats it. What did they do? They just stuck it out. They literally just stuck it out, because they knew that ultimately this is a great product for the market. And so I think if you have that conviction around your product, you understand the market, sticking it out, I see people give up a bit too early. So sticking it out for a long time really is key.
Okay.
And then the last thing I would say is being flexible.
Okay.
Yeah, so I find sometimes people aren't flexible, they don't take on advice, they want to do things their own
just
way.
Their way.
Exactly,
One way.
their way or the highway. I think that's not the way to be successful. You really need to be flexible and just learn as you go along.
You want to add price points too? Because the price point challenge is another big challenge with technology.
Oh, yeah. So yes. I mean, and that's a function of sort of being flexible and understanding your market, right? And so I don't want to be too specific. I think it's generally, if you go out to the market with a product that is 500 naira and they're telling you, I I no go buy you. Then you have to go back to the drawing board and say it's 100 naira as opposed to, no, you must buy at 500. So I think being flexible and understanding the market covers that.
Okay, the other part of my question about your microinsurance.
So we're actually all over the country, actually.
Oh,
so Lagos and Abuja is our biggest markets. But we have, because we work with partner pharmacies in local areas, we're in about 30 states, I think, at last count.
Fantastic.
And you can go online and access it. And we're launching other sort of channels with partners at agent mobile money networks, even the USSD code. But at the moment, most of it is sort of online at our website, and then you can just go on and sign on.
And that's www.WellaHealth.com.
Okay, so as we approach the end of this interview, I would just like to know, based on your experience, especially with WellaHealth and your experience with startups, what type of support pillars do you think would help take this ecosystem to the next level?
Okay, support to the next level. I think we've covered a lot of them. So first of all, sort of policies around, ease of doing business, registering a business, electricity, almighty electricity, just providing the basic infrastructure. Data, for example, making sure that that's cheaper and accessible, it's high quality. I spend a lot on waiting for my internet to load up. So I think there's basic infrastructural things that needs to happen, and government needs to invest in that. Financing, those kind of things. Education for the startups, so the entrepreneurs. So investing in, there's a lot of technology hubs around now that are giving access to training, things like that. I think certainly enabling those be more successful by investing in them, funding programs in them, will be another thing that can happen.
Any plans to add any other thing apart from malaria?
Yes. Sorry about that.
So 40 seconds.
Yeah, so we said malaria, telemedicine, we do some healthcare screening, so blood pressure, diabetes, and we also give you some education content. Over time, we're going to expand that to cover more. Hospitalizations, if you go into hospital, you can get cash back if you do fall sick, So that's one thing that we provide. And we also actually provide some life insurance as well. So for a small amount, we give you a funeral cover, we're calling it.
Okay.
We don't pray for that.